Hey guys, today I'm going to be talking about afterload, its definition, and what it affects in the cardiac output. So afterload is defined as a pressure that the heart must work against in order to eject blood during contraction. It is proportional to the average arterial pressure. So basically, as aortic or pulmonic pressures increase, the afterload on the left or right ventricle increases respectively. It can also sometimes be expressed as ventricular wall stress. So as I said, it has an effect on cardiac output. As we know, cardiac output is equal to stroke volume times heart rate. Stroke volume is affected by preload, which Devery has talked about, contractility, and afterload, which is the resistance to systolic ejection. So there's a few different factors influencing afterload. Ventricular wall thickness and ventricle size change ventricular pressure or the ability to overcome vascular resistance, which is resistance in the aortic or pulmonic arteries or in the systemic arteries. It also is affected by valve function. If valves are moving easily, then there is less pressure that they create that the ventricles have to work against. As I said, wall thickness of the ventricles has an effect on afterload. For example, a hypertrophied ventricle or too large a ventricle with a thickened wall has less wall stress and reduced afterload. It can more easily overcome vascular pressures. Vascular resistance is proportional to afterload. Vascular resistance is defined as the pressure of the blood in the system that is keeping the aortic valve closed. The ventricle then has to produce enough pressure to overcome the systemic pressure in order to eject blood from the ventricles. Pressure inside the vasculature can be affected by stenosis, vasoconstriction, and vasodilation. These can be affected by hormones, drugs, different stuff like that. Stenosis and vasoconstriction are going to increase the pressure inside the vasculature and thus increase afterload. Vasodilation has the opposite effect. Stroke volume, as I said, is affected by afterload. As afterload increases, stroke volume decreases. In a normal heart, it does not decrease too much because the heart can adjust and overcome the increased afterload pressure. In severe heart failure or even moderate heart failure, the stroke volume decreases much more when afterload increases because the heart is unable to produce pressure to overcome the vascular resistance. So afterload has an inverse relationship with stroke volume, and in turn, an inverse relationship with cardiac output. When afterload increases, or there's increased resistance to systolic ejection, it increases end systolic volume and decreases stroke volume. When afterload decreases, it decreases end systolic volume and increases stroke volume. So in summary, afterload is a pressure that the chambers of the heart must overcome in order to eject blood during systole. It is influenced by systemic arterial pressure or vascular resistance, thickness of the ventricular walls, and valve function. And afterload has an inverse relationship with stroke volume and in turn cardiac output. Hope you guys learned something. Thanks.